Welcome to Care Smarts 360 on Air, a home care podcast. I'm Erin Cowell, Senior Sales Consultant at Care Smarts. How many times have you heard just practice more self-care as the magical cure for burnout? Maybe you've been handed a wellness app, a scented candle, or a helpful reminder to meditate between back-to-back meetings. Well, today's guest is here to tell you why that approach isn't working and what we should be doing instead. Patrick Riecke is a nationally recognized burnout expert, executive coach, and speaker who's on a mission to transform healthcare leadership. After years of witnessing the crushing effects of moral distress and exhaustion, he didn't just slap a self-care sticker on the problem. He dug deep to find real systemic solutions. In his book, Let's Talk About Healthcare Burnout, a prevention and recovery guidebook, Patrick reveals why traditional wellness programs are failing and what organizations actually need to do to create lasting change. Today, he's here to break the cycle of burnout, challenge the status quo, and offer a fresh perspective that goes beyond bubble baths and mindfulness apps. Get ready, Patrick Riecke is about to change the way you think about burnout. Welcome to the podcast, Patrick.
Thanks so much for having me, Erin. Glad to be here.
So we'll jump right into it. Self-care is often marketed as the solution to burnout, yet the crisis persists. Why do traditional self-care and well-being programs fail to make a lasting impact?
Yeah, I think because they're excuse me, because they're transactional. They're not relational. They're not advancing that conversation. In healthcare, we deal with really difficult things, and this has always been the case. That part's not new. Nurses, doctors, techs, everybody working in healthcare has dealt with the most difficult things that happen in life and death, literally life and death in a death avoidance society, right? So we're some of the only ones looking death in the face, especially in the United States right now. And that just in of itself, if that was all that was difficult about healthcare, would be enough to say that a bubble bath is not going to fix it, right? It's a process. It's what they're facing every day, what they're experiencing, both with the patients tugging on their heartstrings and the family tugging on their heartstrings. And then sometimes the families and patients doing different things to their emotions, being very irritating or aggressive or even harassing to them. So even if that's all that was difficult about healthcare, the yoga class is not going to remedy that.
And burnout is often seen as an individual problem, but you argue that it's a systemic issue. What structural changes need to happen to truly combat burnout in healthcare?
Yeah, that's a big question, and there's a whole litany of answers to those things. I was saddened to read just a couple weeks ago about this story. I think it was in Pennsylvania where a family member of a patient died. The family member had actually really good interactions with the caretakers before that, but then just something broke in them at that point, and they came in, acted violence. Shot a police officer, tied up these things are unfortunately top of mind, I think, especially for nurses, anybody that's in that patient care, that direct care setting. They're in the home, especially, for our home care coworkers going into these places that are less controlled. And so there's this system of the way that finance and everything is tied together with healthcare. And am I going to be able to pay for this? What's this going to mean for me? The fear that all of us have, even if we're in a relatively financial stable situation, even if we understand healthcare. My daughter had an ER trip recently, and she's perfectly healthy, perfectly fine, and really wonderful. But even at 16 years old, before the EMTs came into our house, she said, "Dad, this is going to cost a lot of money." At 16 years old, and we hadn't put that on her at all. We hadn't said anything about it, but she knows that healthcare is tied to finance. And so these constraints, not just the quality controls, but the constraints of this is what you can and can't do. This is what's going to be approved. This is not what's going to be approved. So you've got to, if I can be sort of paint the picture, you've got a nurse who has decided to go into this field because she cares deeply about people. She wants to help people. She wants to be there for them. And then she's told that won't work. What you want to do, what you feel like you need to do, what medically, clinically you've been trained to do, you can't do that because it doesn't work out on the financial and it can't be reimbursed. Well, that's a systems thing that goes all the way up to the government, but then goes all the way down through our organizations too. And it's not a magic wand sort of thing. There's no way to just If there's a way to change the whole healthcare system in the US, hopefully we would have done it by now. But it's something that healthcare workers live with every single day. And then when you've got when you've got individual agencies or healthcare organizations trying to pretend like that's not a big deal and we should just all deal with it and not have any feelings about it, it's just unrealistic because our frontline coworkers, whether they're in the home, whether they're in the clinic, they're in the hospital, they feel it. They feel it every single day.
Absolutely. And moral distress and ethical dilemmas contribute significantly to burnout. How can healthcare leaders create environments where professionals feel supported in these high stakes situations?
Yeah, I think a lot of as a leader in healthcare, in a hospital system for 10 and a half years, you feel the temptation to whitewash things, to bright side things of, oh yeah, this is happening, but it's okay, and we need to chin up and we need to be resilient and we've got to show up and do our work anyway, et cetera, et cetera. And a lot of that's true. But I think honesty from leaders, even when you can't change things, being able to do two things. One is there's sometimes you can see this is super stressing out this coworker. And so, is there an opportunity to let that coworker opt out of that situation? Whether it's a certain patient that's just really, maybe it's even just something where it tugs at their heart. This patient reminds me of my mom who just died, or something like that. And so they feel that moral tension, that ethical tension, that emotional tension, or it's something that they feel like this doesn't align with my values. What we're doing here is totally off base with what I think we ought to be doing, what I think I ought to be doing in the world. And maybe several people feel that, but you might be able to identify that one coworker that this is just really profoundly affecting that person. So offering them an opt out, obviously still have to provide services, but saying, maybe it'd be okay for you to opt out of this one. And then when we can't, as leaders, we can't offer an opt out, sort of things just are the train's on the track and it's coming through one way or the other most of the time. So if you can't offer that opt out, then taking a timeout afterwards. And this is where leaders can just acknowledge and say, man, I'm sorry you had to do that. I'm sorry this happened. I'm sorry the system is this way. I can't tell you how many times one of my teams responded to every patient death, every patient trauma. So, every day we're coming in and during the pandemic, sometimes 15 deaths in a day. Well, there's nothing I can say or do that's going to fix that for them. I'm not going to be able to say, well, you need to understand that blah, blah. What am I going to say? This person just responded to 4 deaths in the past 6 hours, but bringing them in and acknowledging it, taking that time out to say, today was a hard day, and I'm sorry that you had to do that. It's amazing how many times those coworkers would leave and say, "You helped me so much. Thank you for being there for me." I'm like, I really didn't do anything, but just that minute for us leaders to give that acknowledgement, to not try to bright side it and whitewash it and say this is just part of it. You just got to have a stiff upper lip. You got to be resilient. Go home and take that bubble bath or whatever. Like that's not going to
Mhm.
fix it. But you saying like I get it. I'm sorry, and I see what you're having to do.
Yeah. And if self care isn't the solution, what are the key leadership strategies that actually help prevent burnout and create a sustainable work culture?
Yeah. So there was a funny quote from an ER doctor in the middle of the pandemic. She left her job and she was interviewed by the local news. And they said, you know what, in the middle of a pandemic, why did you leave your job? And she said, well, the work was hard, but the lack of support was really the main concern. She said, I think if somebody had been listening to me, I could have stayed in my job and been miserable for another 6 years. So she's trying to demonstrate like the work is always going to be difficult. You're not gonna stop doing if you're a part of a home healthcare team, a hospice team, you're not going to stop that work from being difficult, but the support, the listening. So there's really two primary mitigators of burnout because we are going to experience some of this moral distress in healthcare. But the two primary mitigators, one is having friends at work.
Mhm.
How many of us have stayed at a job for probably a little too long because we like the people we worked with. We're spending time with them. But that normalizes, when you've got a friend at work, whether you're just seeing each other at work or you're doing things outside of work, when you go through something difficult, you feel like you've got somebody to talk to. They're going to normalize those things and say, yeah, yep, this is what we've all experienced. I'm sorry that that's going on. I'm glad you're still here. That does a lot to decrease. So leaders can facilitate those peer relationships. And then the second primary mitigator of burnout is that leader support, that organizational support. And I'm afraid that a lot of leaders right now are telling themselves, well, we're paying for this wellness app and we've got yoga classes on Tuesday at 6 p.m. or whatever. So they should feel supported. Well, that's BS, and not that the program's BS, but that you saying they should feel supported because this is out there is just not fair. What matters is, do they actually feel supported? And right now there's some studies that just came out saying that 51% of American coworkers are looking for a new job. So over half of people are wanting to switch positions, and that's the case certainly in healthcare too. The top thing that they're looking for in a new job, even above pay and an increase in pay and an increase in benefits, is a better sense of well-being at work, a better sense of work-life balance, whatever work-life balance actually is, right? But they want that. So there's a lot of coworkers out there that if they could change jobs, even if the pay was the same and there was no pay increase, but they felt like there was an improvement in their work-life balance, that they would take that leap. The primary thing that indicates whether or not these coworkers feel like the organization supports them is the listening skills of their direct leader. Will their direct leader bring them in, shut their own mouths and listen to what's going on and believe them, and instead of trying to, oh no, it's not that way, and talk them out of whatever they feel, to listen to them. Again, going back to that emergency room doctor, she probably would have stayed for another 6 years if she'd had a leader like that.
Right. And you work with executives and healthcare leaders on building resilient organizations. Can you share a success story where a team transformed its approach to burnout?
Yeah, so what I just love seeing is the change conversation, and to where, because I come in, I'm I'm there for a morning doing a workshop or doing a keynote with a lot of people in the room, and you never really know until afterwards, like, did they even talk about this afterwards? So just heard from a colleague who was at a location where I went recently to say that conversation has continued. A CEO who for an organization I spoke with recently, he shared that this was an all leader meeting right after I talked about it, and he said, how are we doing? And let the managers, the people that are a little bit closer to the ground, tell him how they were doing. So I think, I mean, I'd love to see these places implement these huge well-being programs, but again, I think that the backbone of it is that conversation. So seeing, 2 weeks, 2 months, 2 years later, to see these organizations just still talking about it and bringing it up. Remember when Patrick was here, he talked about how leaders who listen, make such a big difference, or for coworkers prioritizing themselves and drawing boundaries and that sort of thing can make a difference. So, my that's the time I'm most grateful, is when I hear just that conversation is ongoing.
Yeah, absolutely. And last question for you, Patrick. Home care is facing staffing shortages, rising demand, and evolving regulations. What do you see as the biggest challenge or opportunity for home care agencies in 2025?
Yeah, the thing I'm really scared about is not just 2025, but going forward, because some of the pipeline of especially nurses, there's the pipeline is just not what it used to be, and because this burnout affects not just people who are out there in the field, working for these home care agencies, but it affects nursing students, it affects nursing professors. There's not enough nursing professors, wait lists for nursing programs, that sort of thing right now is really concerning, not just for this year, but for going forward. Um, I think for a long time, of course, healthcare has just been a growing behemoth in the United States, and now it's growing in pockets and shrinking in a lot of other pockets. And I think to accept whichever point you're at, I've got a good friend, actually a family member, who's leading a new in-home hospice agency, and they're growing leaps and bounds right now. They're hiring, having success at hiring, they're taking on new patients, their census is rising, and so enjoy it, right? Like, enjoy that that's where you are. For other agencies, you're seeing a scaling back, and maybe your volume's changed, your staffing's changed, and to try to continue to do what you've always done with lower volume, with lower income, with lower numbers of staff, is, I think, when organizations really get into trouble, because you're trying to say, hey, this is what we did with a team of 90. Now we've got a team of 72, and we're trying to do all the same things without cutting back on the quality and the patient care. Are there extras that need to trim, and to embrace that season? Because when you don't, that's when the organization gets into real trouble.
Yeah. Well, thank you so much for Patrick for sharing your expertise. And to our lovely audience, thank you for tuning in. Until next time, I'm Erin Kell, signing off.